Hello, everybody, and thanks for joining our 3Rs training webinar today. I'm very excited to have Erika Martinelli with me today. She's from the Eurogroup for Animals, and she will tell us the exciting news about the progress of the European roadmap towards phasing out animal testing. Erika holds a master's degree in both chemistry and in chemical innovation and regulation. And first, she had a career in analytical chemistry research, and then she decided to transition to the intersection of science and policy, specializing in chemical regulations. And her experience includes serving as a regulatory officer for a consultancy, and she also worked for the European Chemicals Agency, ECHA. And as the Chemical Strategy Policy Officer at the Eurogroup for Animals, she works closely with EU institutions to advance chemical legislation. And she focuses on developing science-based policy to support the adoption of non-animal methods, driving a regulatory shift towards an animal-free approach to chemical safety assessment. Erika, thanks a lot for being here tonight and talking to us about this exciting topic. And yeah, we are looking forward to your insights. And yeah, thanks a lot.
Thank you, Kathrin. Thank you for inviting me, and thank you all for joining today. It's so nice seeing many of you from different parts. As Kathrin introduced it and said, today we will talk about the European initiative of developing a roadmap toward phasing out animal testing for chemical safety assessment. During the presentation, we will define how we protect the animals used for scientific purposes in the European Union, and why it's important to phase it out, and why it's important now. And then we'll deep dive in the roadmap and the roadmap to phase out animal testing, describing the advancement of the roadmap that is still ongoing and what will be needed to the roadmap for succeed in the implementation phase. And I hope to give you some future perspective that this roadmap will bring at European level, but hopefully on a global level. Before to start, just two words on Eurogroup for Animals. Eurogroup for Animals is a pan-European organization, and we are the official is in the European institutions of animal welfare. So our main objective is to shape and drive the policies and the legislative changes for animal protection. And specifically, my team, the Animals in Science team, is a team where we focus on the replacement and the phase out of animal testing inside the European legislation regarding chemicals, cosmetics, pharmaceuticals, and also basic research. We represent members across all Europes. We have 100 members across all Europes, all European Union countries and other European countries alongside Australia. And now we can start. So in the European Union, we protect the animal used for scientific purposes with the Directive 2010/63. This directive is designed for limiting the number of animal testing and also set some standards for house care, for example, caging, and it forbids the use of great apes, and is applicable for all vertebrate animals and certain invertebrates. So at this moment, it doesn't cover invertebrates and embryo stages. The animal testing right now, we estimate we have official numbers from the European Commission that estimates that we have around 200 million of animals that are used for scientific purposes globally, of which 8 million are used inside the European Union, of which only the 17% is used for regulatory purposes. This number is, I want to highlight that this number, first of all, these numbers are a bit outdated, but these are the only official one that we have right now. But also this number of just the 17% for regulatory purposes is because it doesn't consider all the animal tests that are performed outside the European Union to comply with the European Union legislation regarding animal testing, so an underestimation. When we talk about why it's important to phase out animal testing, the first we can think about that this an ethical issue, and of course it is, but it's matter also of a scientific case, because there are very proven limitations of current animal models compared to non-animal methods. Specifically, non-animal animals models can vary in their response compared to the toxicity on the human body. And usually these tests are designed to be performed in high doses and artificial conditions that are not relevant for human toxicity. Also, they usually have high costs, and they are very slow, so they limit the number of chemicals that is possible to access, also limiting our knowledge. On the contrary, new non-animal methods or NAMs are directly relevant to human biology and can give you also mechanistic insight, so they can reveal how the chemical causes a determinate toxicity, for example, and also they can be performed through high throughput screening methods, which means that they can be performed in with 2,000 of chemicals that are tested and screened at the same time, enabling a faster chemical safety assessment. The principal non-animal methods are in vitro methods that we find it. We have so-called in-glass test. They use human cells and tissues. We have in silico models that are very advanced, and they, for example, has the CUSAR modeling. They are able to predict the chemical toxicity based on the comparison with the structure of compared known substances in chemical methods that are able to mimicking the initial steps of toxicity pathways, and also organochip. The organochip are very advanced non-animal methods that use living human cells to replicate in chips, to replicate the functions of organs. So they can be used for testing systemic toxicity, testing the systemic toxicity. When we think about the shift toward an animal-free model, so a more humane free science, we find that at the moment we are facing a global scientific shift. Currently, there are more than 45 countries all over the world that have an animal testing ban for cosmetics. We have also some laws that are implemented or are implementing around the globe. The Australia, for example, has a plan to phase out animal testing in medical products by 2038, as well as the USA, in which we have an act for ban mammalian toxicity by 2035. And also, after the 2022 FDA Modernization Act, we have a regulatory acceptance of animal-free methods. And this is our very brand new information, but since this July, the NIH announced that they will stop to fund research based solely on animal tests, while Canada has activated a strategy to integrate the 3 Rs inside the Canadian Environmental Protection Action. But when it comes to Europe, Europe has been from front in the phase out of animal testing during this year. Since the implementation of the directive and then the ban on cosmetics in 2013, there was a movement, a political will, a movement given by the public, stakeholder, and a political will that converge to arrive to the decision of the Commission of commitment to develop a roadmap for phasing out animal testing for chemical safety assessment. This is important to underline that this initiative of the Commission has been pushed by Eurogroup for Animals and other animal welfare NGO that in 2021 started an European Citizen Initiative that was concluded in 2022 that gained more than 1 million valid signature and was an European Citizen Initiative to phase out animal testing. So to this initiative, the Commission replied deciding to develop the roadmap for phasing out animal testing in chemical safety assessment and other initiatives to transition through an animal-free model. But what is actually this roadmap to phase out animal testing? So it will focus on chemical safety assessment, so on that 17% of animal testing that we saw at the beginning. But what it is, it will be a European Commission communication accompanied by a staff document, and will have the objective of create a plan to accelerate the transition away from animal testing, and it will cross over 15 legislative areas that at the current stage rely on animal testing. I want to make a clarification that from now on, whatever I will say is on drafting stage because the roadmap has not been published. So I will give you this insight as an organization that works in the drafting of this roadmap. But the content, the final content of the roadmap may be vary from what I will present today. So who is contributing to the roadmap? Who is drafting to the roadmap? The roadmap is a European Commission initiative. So the lead is on the European Commission itself that has created an inter-service group with the main general directorate of the European Commission. We have the Environment Directorate. We have the Industry and Economic Growth Directorate. We have Research and Development and also Human Health Directorate. But together we have also the regulatory agency, the main European regulatory agency, the European Chemical Agency, ECHA, the European Food Safety Authority, EFSA, and the European Medicine Agency. This inter-service group are leading three working groups that will have the aim to focalize. They are focalizing on the human health transition towards an animal-free assessment, the environmental safety, and the change management. They will have the scope of overarching the progress of the roadmap. At the moment, in the working group, they are participating the inter-service group, but also a combination of representatives from the member states, stakeholders, academia, and also NGO. As an animal protection NGO, we participate in all the working groups, and together we jointly contribute to the drafting and the development of the roadmap. Alongside this long overcommitment of the working group, there are also stakeholder consultation process that the Commission has been made since the announcement of the roadmap. The working group are able to receive inputs from a broader stakeholder group that includes also many people from research and academia. The roadmap will have concrete action. They will be divided in short midterm plans that will be more focused on the 3 Rs, but the ultimate goal of the roadmap is the phase out of animal testing. So what we will need at the end, it will be a paradigm shift of the current safety assessment system. And for this, we will need also provision for legal uptake and a new validation systems of non-animal models. The roadmap will include also indicators that will mark the progress and will monitor the progress during the implementation phase, and will recommend the organizational structure that during the implementation phase will be able to manage the entire process of transition. So the working groups are currently working in accordance to the so-called three-basket approach. This three-basket approach means that the actions are divided in short-term actions, as for example, available methods that you can already put in place as they are nowadays, or midterm action, and then we have the long-term actions that are the new definition of the protection goals of the European Union. It's important also to notice that the working groups are not working from scratch, but they are leveraging findings and initiatives that were already in placement or are ongoing in the European Union. So they are joining also these initiatives to have a very broad overview. So as I said, we had several consultations with the Commission. So the Commission organized three workshops. The last one was in this June, in which we collectively joined together to advance to the drafting of the roadmap, so not in the separate manner of the working groups. And now we are in the last stages with the targeted interviews that we are doing in these days. And the aim of the Commission is to finalize the draft and have the final publication of the roadmap in the first quarter of 2026. This means that from March 26, I will say, we'll start the implementation phase. But where are we in this moment in the drafting? So as I mentioned, the roadmap will provide an organizational structure, and this structure for the implementation phase. And this structure will have a steering team that will be led by the Commission and will have representative for industries, member states, and NGOs. And the steering team will be advised by 3 different advisory boards. And these advisory boards will be the agency collaborative structure, the interagency working group, and the regulatory science network. As I say, in this moment, we are in a sort of draft. So this organizational structure may be vary, but the core principle should stay the same. And the steering team, the principal function of the steering team will be the direction of the implementation and overseeing the entire process of the implementation. And while the 3 advisory board, the agency collaborative structure will provide all the scientific advice on the regulatory process and will identify the regulatory needs for advancing of non-animal methods inside the regulation. The interagency working group will be a working group only of the principal agencies, so ECHA, EMA, and EFSA. and will be a collaborative platform to create more awareness and more alignment among the agency, because until now they work in a separate manner, while the regulatory scientific network will provide all the scientific and technical aspects that will be needed for advancing in the implementation of the roadmap and finally to the paradigm shift that we hope. So at the current stage, we have already some recommendation from the working groups. We have the recommendation from the Human Health Working Group. As I said, the final aim is having a paradigm shift toward an animal-free system for human health. And the principle for the paradigm shift, so the working group worked on key principle. So prioritize mechanistic non-animal methods for safety assessment, use, for example, mechanistic and molecular insights, and have a high throughput and up-to-date methods inside the regulation, ensure a reliable high VAV and ADME characterization, but also they have the final goal of maintain or exceeding the current protection levels that we have in the European Union, basing the system on NAMs. For performing this paradigm shift, they identified pillars of work. So they started identifying the critical needs that would be needed for advancing non-animal methods for human health. So develop non-animal methods that are equivalent, have equivalent protection as animal testing or more, define the acceptance criteria or the applicability domain in which those animal methods can be used, address the problem of the exposure and complex endpoint, because for complex endpoints we need still research ongoing, and also apply already NAMs in existing regulatory frameworks and strengthening the integration of in silico in vitro tools, for example, with read-across NTK-ADME and omics, and redesign the regulatory system. This means changing the classification criteria, for example, and as we can see, they have already sorted out, this is a summary of the sorted out activity in short and medium and long term. For example, a short-term action that we can already perform is increase the use of computational approaches, but a longer action that will require more research and more advancement, for example, would be establish frameworks for systemic toxicity. Regarding the environmental safety group, again, we are talking about a paradigm shift. And in these cases, the emphasis will be to understanding the chemical biological interaction on cell level and extrapolating to relevant environmental effects. So for the environmental safety working group, there would be needed a definition of the next generation risk assessment, and it will be needed to prioritize critical pathways, but also develop new tools and new strategies for example, improving tier testing approaches for hazard identification and characterization using NAMs or computational toolset. For the long-term change, the Environmental Safety Working Group worked on two main areas. So integrate the hazard and the risk assessment, and then the governance and monitoring collaboration. So for the integrated hazard and risk assessment, this means integrate, for example, distribution, fate, and effect data in hazard characterization, or encourage multi-sourced data fusion. And as we can see, they already provide some ideas of which would be the endpoints that could be used already in the short term as a fish acute toxicity, for example, but for mammalian and birds, and for fish aquatic chronic toxicity, there is still long work to go. Regarding the Change Management Working Group, so as I say, the Change Management Working Group has the role of overseeing the process of change. So they will oversee all the implementation phase. But right now, they are mapping the current change through the transitional initiatives. For transitional initiatives, we mean every effort that currently on European level, but also outside the European Union, are reducing or replacing the use of animals for regulatory assessment of chemicals. So the change management is currently mapping all of them. Here we have some examples of this transitional initiative. Actually, researchers can submit, can apply to the JRC, to the Joint Research Center of the Commission, for be accepted as transitional initiative, so be included in these studies. And besides this mapping of the change that will help to guide also the other two working groups, the Change Management Working Group is developing some indicators that will use it during the implementation phase to track the progress. They have divided the indicators in several categories. We have the engagement that goes from the public awareness, but also from the stakeholder collaboration, for example, and commitment in phasing out animal testing. The status, this is more a quantitative. There are more quantitative indicators. So they are, for example, the level of fundings, if there is an increment, the cost effectiveness of NAMs, the uptake of NAMs in regulation. And then there will be indicators for monitor the counter progress. For example, persisting barriers that can be both qualitative but also quantitative. For example, social perception of NAMs, but also issues related to the method, as for example, methods for systemic toxicity that are not currently ready. So the idea is that this will monitor also. And we will have also composite indicators. There will be statistically relevant indicators that will encompass several aspects. So at the moment, we have developed this, but we already know that the major effort will be during the implementation phase. So the roadmap currently is already foreseeing some area of work that will be very relevant during the implementation phase. So during the implementation phase, will be necessary to maintain the accountability. So that organizational model that we talk about, the governance structure, will be it will be needed, that will have the control all over the entire process. But it will require also accelerate the validation system right now, made legal changes, because the roadmap doesn't have a legal mandate. The legal changes of those 15 pieces of legislation will follow the normal legislative procedure. So they will be needed regulatory update of legislations. Then will be needed, of course, funding for implementing, having this final paradigm shift, but also will be a matter of global harmonization, because some of our legislation are completely interlinked with the global provisions, as we will see. So we will need also to influence on global level, internationally, with the roadmap. So at the current moment, the validation process here, I mean, just a very simplified slide of how we accept non-animal methods. So starting from the method development, but currently, the validation process is the most burdensome, because it's the longest. It takes like on average 5-7 years for validate a method, but also a lot of new NAMs and methods that have been developed doesn't pass the validation phase, and this is because probably they are not designed for regulatory acceptance, for example. So what will be needed during in the roadmap, so the needs of accelerating validation comes from the need of defining also the regulatory needs. So the roadmap will streamline some pathways to defining the regulatory needs. There are already in placement and ongoing efforts. For example, the European Chemical Agency is a couple of years that is releasing a document called KRS of Regulatory Change, which is an open document to the scientific community to work in defined area that are of use or for regulatory use. But this will mean also establish and assessing the regulatory readiness of new methods, and this will be increasing the power, will be needed in an increment of the power of the GRC ECVAM, which is the European Union for validating non-animal methods. And after that, we will need an actually acceleration of the validation system. So finding agreements for method validation at the OECD level, but also investigating context of use for using qualification instead of validation, when validation is not strictly necessary inside the regulation. But this will mean also support and increase the EU NETVAL, which is the European Network of Laboratories for Validating Alternative Methods, which will be needed to be implemented and strengthened. So there will be an amplification of the NETVAL needed. Regarding the funding mechanism, currently the European Union is funding non-animal methods projects based through the Horizon fundings, and we saw in the last years that we had around 90 million euros per year that are invested in NAMS project, which are not a lot of money, especially compared to the fundings of the United States. But the European Union this July announced that they will substantiate the highest amount and the highest budget until now, since the creation of the European Union for the research. That will be of 175 billion of euros. And this almost 200 billions will be divided in pillars, and these pillars in all these pillars, there are opportunities for NAM projects and developments in accordance to the objective of the roadmap. So our role also as NGO will be to push for the channeling of this funding through non-animal methods. But also we can have other funding mechanisms and other funding opportunities that could come from stakeholder investments, like we have already in placement has the APA project, but also internal investments of industries that will decide to invest in the research or development in their industry, but also at member state level. We are already ongoing projects at member states level, for example, for implementing and increasing the capacity of the NetVal labs, but also international investments can be other possible funding opportunities. When it comes to the legislative changes, so as I said, these are a bit the pillars that would be needed to change during the implementation phase. So as I said, the roadmap cannot prescribe, they cannot mandate legislative change. But the legislative change can come with revisions of the regulation. Under the scope of the roadmap, there are these 15 pieces of legislation, of which the biggest one is the REACH regulation. The REACH regulation is the restriction, evaluation, authorization of chemicals, and is the biggest regulation regarding chemicals that we have in the European Union. And this regulation is strictly interlinked with the CLP regulation. The CLP, it's the classification, labeling, packaging regulation, and is based on the United Nations Global Harmonized System. So we implement in our internal regulation the Global Harmonized System. So the challenges that we need to overcome when it comes to legislative changes is, first of all, that it would require a legislative procedure. So it would be needed that the European Union needs to decide to open the legislation for revision. And all this legislation in the 15 areas that we saw have an historical reliance on animal testing. Again, there will be a problem of global harmonization that we'll dig in deep later. Unfortunately, our system, our regulatory system, is a system that is not, well, it's not flexible, as for example, the one from the United States. So we cannot prescribe directly the regulatory uptake of non-animal methods. It's considered a hard law. But there are some part of the legislation that we can actually change are the soft part of the legislation, so-called soft part of the legislation. And this soft part has when in the legislation are not directly prescribed animal testing. This part of the legislation can be more easily updated through guidance that are written from regulatory agencies that are able to refer and uptake non-animal methods. The problem is that in the European Union, the regulatory agencies, as ECHA, are not able to get the non-animal data on their own. They need to rely on the non-animal data that are given by the industries. And this opens, and for building these guidances and evaluate the non-animal methods, they need reliable data and they need sufficient data. But this opens to the so-called chicken and egg problem for the industry, because the industry are usually very hesitant in submit NAMS data in the formal regulatory dossiers, and this is because they fear that will not be accepted from regulators. But on the other hand, regulators need those data for developing the guidance and finally accept in the soft part of the legislation the non-animal methods. For trying to overcome this challenge, the roadmap will also provide the introduction of a so-called safe space. So it will create a net between regulators and stakeholders and industries, in which the industries could be able to submit, in accordance, of course, of confidentiality reasons, they will be able to submit in an informal way NAMS data to help regulators to build confidence and build the guidance that are needed. But as I said, we need regulatory change in a hard part of the legislation. And this is a momentum in the European Union, because since the announcement of the chemical industrial package this January from our President of the Commission, several chemical legislation opened for revision. And among that, is currently opened the REACH legislation for revision. This means that, again, our role as an animal welfare NGO, but as an organization that operates in the European Union institution, is trying to align the objective of the roadmap. So those recommendations that we are developing right now in the roadmap, already in this revision of the legislation, to align the objective and to try to put provisions, for example, all the short-term actions that will be recommended in the roadmap, be integrated already in this revision of the REACH legislation. As I said, another problem roadmap will try to cover is the global harmonization. I indicated during the legislative areas the CLP, as I said, and I said that CLP needs to be aligned to the United Nations Global Harmonized System. And although it doesn't prescribe new animal testing, both the CLP and the GHS, they rely on a classification criteria that is outcome-based. This means that it's based basically on data coming from animal testing. So are enabled to incorporating mechanistic data from NAMS, for example, for complex endpoints. So what we are proposing right now in the roadmap, and we will hope to drive a global change and a global acceptance, is a redesign of the classification criteria for systemic health endpoint for use mechanistics understanding. And for example, use intermediated effects, like for example, the endocrine disruption as proxies for complex outcomes. And by doing this, we aim to push for an international acceptance of this revised classification criteria, and potentially establish, at least in the early stages, an hybrid system for a gradual phase out of traditional classification criteria. And from this comes also what this roadmap aims to bring and the future perspective that will open. As we say, there will be an increment in strategic investments, and will be a prioritization of funding development and validation of non-animal methods, especially for complex endpoints in which we still need a lot of research on. We will need more expertise in science, but also risk assessors and regulators expertise. So we will need more education, training courses to be able actually to interpret, not only develop the methods and validate the methods, but also interpret the data and trying to converge in integrated approaches. We will need more data sharing and more transparency. And for this, the European Union already committed to develop a common data platform among all the agencies that will be enabled to share all the chemical safety assessment data that are in the repository, in the separate repositories of the agency, in a joint common data platform that will be accessible to everybody. So it will be of use also for researchers. And this, for maintaining this momentum, will still need, as we are drafting today, the roadmap is a draft of several actors that are joining together to draft the roadmap, but we'll need still this during all the implementation phase, alongside, as I said, the legislative actions. And this will also open opportunities, work opportunities, especially in the academic research, but also for research and development inside the industries. But also they will open more roles in policy and advocacy roles. But will be fundamental having also interdisciplinary skills, so people that will be able to combine scientific knowledge to regulatory knowledge, and this will bring also innovation in biotech and data science for the development of the new systems. And to conclude, just like some final takeouts of the roadmap. So this roadmap has the aim of having a real paradigm shift for the safety assessment right now towards an animal-free science. Is a complex shift because it will require several actors, several changes in the legislation and research, more research and advancement, but will create also more opportunities in Europe, but also internationally, because we hope that this initiative of the European Commission will taken also internationally. And so to conclude, the success of this implementation will also come from the cooperation of scientists, regulators, industry, civil society, and also the public engagement. All the action that brought us until now to the roadmap will be, and all the actors that brought us to the roadmap right now will be the actors that will be needed to the future steps. And with this slide, I conclude. Thank you.